The U.S. Department of Labor is asking you the important questions: who they should identify as partners, who should inform stakeholders, what issues employees are facing and solutions to them, and what issues employees are facing when trying to obtain benefits. We are asking you to please vote for the recommendations we have put forward. Recommendations put forward for the long COVID community came from your participation over the last 2.5 years. We are asking you to please help us elevate those needs and vote before the votes close on August 10th. If you feel the COVID-19 Long Hauler Advocacy Project should be involved in informing stakeholders, we need you to go vote for us. Unfortunately, votes will be considered, and we do want to ensure that we have a seat at the table to advocate for you. The COVID-19 Long Hauler Advocacy Project ensures comprehensive advocacy for the long COVID community, which means acknowledging all of its associated conditions and building partnerships with those organizations, researchers, physicians, and communities to ensure we work collaboratively. Our third recommendation is expanding Social Security disability to include long COVID and associated conditions. The level of disability seen in long COVID and associated conditions is largely underestimated, and we see a misguided focus on workplace retention when many are well past that threshold, and it is not being recognized or planned for accordingly. Our fourth recommendation is capturing dynamic disability in Social Security and other forms of disability and assistance. Capturing dynamic disability is essential for all forms of assistance. A large portion of the long COVID community and those with associated conditions suffer from dynamic disabilities. It's time to recognize and implement help for this population. COVID-19 long hauler advocacy data shows nearly 30% of long haulers are first responders, healthcare workers, and educators. They are being failed by workers' comp and turned away from healthcare and pay. These aren't your typical replaceable jobs and are in already stressed fields. We encourage workers' comp guidelines and reform. BIPOC communities, single parents and caretakers, pediatrics, and independent contractors are only some of the communities overlooked in data collection and planning. We have 9 special populations chapters that help us better understand some of the issues faced in some of these communities. We outline some of the issues faced in our recommendations. There is no excuse as to why we do not have national public education and awareness campaigns on long COVID at 2.5 years into the pandemic. As we have before, we're calling for accurate national commercials, billboards, ads, and more to educate the public on long COVID and its associated conditions. Recommendation 8 focuses on long-term employee safety policies. Investing in the long-term health of employees is in the best interest of the employer and the employee. We lay out a comprehensive approach of what that may look like. Recommendation 9 is for a national dashboard to report noncompliance and submit evaluations that would help inform guidance. Many employees do not feel safe asking for revisions to accommodations, making complaints about coordinators, nor do they have the time to wait for EEOC responses. Recommendation 10 focuses on assistance programs and virtual certification, recertification, and licensure programs, as well as licensure and certification extensions for employees with long COVID and associated conditions. Employers can help employees by supporting legislation that supports our shared goals and offering other help to employees. Why vote? For 2.5 years, the long COVID community has needed lawmakers, employers, and medical providers to listen to and help us. We have 10 days to provide input that will inform policy for years to come, impacting tens of millions of long haulers, their families, and the nation as a whole. If there were ever a time to lend your spoons and your voice to ensure that policy that may last for years captures what matters most to you and others with long COVID, now is that time. So how do you vote? You can follow the directions on screen or head over to our website and watch the how-to video our Director of Education, Nisha McRae, has put together for all of you. We deeply appreciate all of your support, which further helps us support you. Motivated to get more involved? The COVID-19 Long Hauler Advocacy Project is encouraging you to get involved in our advocacy teams. We have 51 state advocacy teams, including Washington, D.C., and 9 special populations chapters. You can learn about these on our website and register as well. We need more people out there in the community, educating others and raising awareness about long COVID, but also taking the initiative to educate lawmakers and utilize the information and tools that we put forward and just help elevate those efforts. We hope that you'll consider joining us in fighting for efforts like you see elevated here with the DOL recommendations, as well as many others faced by the long COVID community. Thank you so much for all of your support. We appreciate all of your votes, and we look forward to continuing to be your voice and advocating alongside of you and everyone else with chronic illness and disabilities. The COVID-19 Long Hauler Advocacy Project